In this academic year, I've attended both the sports massage and the acupuncture dry needling course as an adjunct to my physiotherapy degree at the University of the West of England in Bristol. I've learned a lot and had a very eye-opening experiences in both courses. So if you're new to the channel, hello, my name is Ryan and I'm a final year physiotherapy student studying in the University of the West of England in Bristol. So in this video, I'd like to share some of the things that I've learned in both the sports massage and the acupuncture and dry needling courses, as well as explaining their differences and share some of the eye-opening experiences I've seen as well. So first off, let me start off by explaining why I took these two courses as an adjunct to my physiotherapy degree. So the first reason is that I'm a big sports fan since when I was a child. Especially I'm a very huge basketball fan, and sometimes I'd even watch football and tennis as well. And I'm interested in the physiotherapy management of these athletes. My interest to that grew even more during my shadowing experience back in high school, where I've seen the physiotherapists use acupuncture and sports massage along with strength and conditioning exercises to help with patient rehab. Also in the physiotherapy course at UWE, we only learn about the treatment modalities of patients that are either acutely unwell or patients having different types of neurological or respiratory diseases or patients having forms of MSK injury, and we apply them into practice in placements. However, I wanted to expand my knowledge on treatment methods to a wider range of patients. Also in the MSK modules in the first year and second year, we've only briefly talked about sports massage and acupuncture and the effectiveness of using both treatment modalities. But I really wanted to dig deep on how we perform these treatment modalities. So therefore, I think that joining the sports massage course and the acupuncture and dry needling course can help me really reach this objective. So now I would like to talk about some of the skills and knowledge I've learned in both the sports massage and the acupuncture and dry needling courses, as well as some of the eye-opening experiences I've learned in both courses as well. So the level I took for both courses are the level 4 foundation sports massage and the level 4 foundation acupuncture and dry needling course. So starting off with the sports massage course, we started off by revising the level 3 materials such as cell structure, the lymphatic system, to build up the foundation sports massage. We also had a review of the anatomy of the human body, such as muscles and bones that are involved in the hip, knee, foot, and ankle. And we also kind of reviewed some of the pathologies of the MSK injuries that we have covered in the first and second year of the MSK module. After revisiting the anatomy of the human body and the pathologies of the MSK injuries, we got into it with learning with the massage techniques. So these massage techniques that we've learned are effleurage, petrissage, ironing, pounding, hacking, and cupping. So starting off with effleurage, which is the very first step to every massage that we do. So effleurage consists of long stroking movements conducted by the whole hand to increase the activity of the lymphatic system, basically to get things going. And once effleurage is done, then we start with petrissage, which is a series of massage techniques consisting of kneading with hands, thumbs, and the flat surface of the hand, thumb rolling, and squeezing. Once the patient is comfortable with petrissage, a mixture of ironing, hacking, pounding, and cupping will be used on the patient. Other than learning the fundamental massage techniques, we've also learned some advanced massage techniques as well. The advanced massage techniques that we've learned are the muscle energy technique, the active release technique, the connective tissue massage, trigger point release, and soft tissue release. So the muscle energy technique basically utilizes the muscle's own energy to lengthen and strengthen the muscles and also to improve the range of movement of muscles. The active release technique, it's a technique that is used to relieve tissue tension by removing fibrous tissue. The connective tissue massage is a technique that loses tightness of the connective tissue and help promote remodeling of collagen in that specific tissue. So the trigger point release, which is my favorite technique of all massage techniques, is a technique that uses to alleviate stress in the muscle by releasing knots in that specific muscle. So some of you guys may wonder, how do you identify the trigger point during the massage? So to identify the trigger point in the massage, you palpate the muscle belly. When you feel an area that feels tight and you ask the patient, oh, do you feel a bit of pain in there? And once the patient reports the pain and reports that, oh, I'm feeling kind of 7 out of 10 pain on the visual analog scale, then you found the trigger point. Once you found the trigger point, hold that trigger point by pressing on it around 10 to 20 seconds for the pain to diminish. The soft tissue release is a technique that applies pressure to a specific point in the muscle by stretching it to hopefully increase the the flexibility of that specific muscle. So for the acupuncture and dry needling, we started off by learning the basics of needling and needling safety. So we start off by learning the appropriate way to insert a needle without harming ourselves or the patient. So inserting needles into human tissue can be visually quite painful, as you can see in the pictures there. We start off by inserting needles into a Mars chocolate bar to have a simulation of inserting needles into human tissue, because inserting a needle into a Mars chocolate bar is a similar feeling to inserting a needle into human tissue. Once we get more comfortable with inserting needles, and we start to insert needles into human tissue. We also had a look at meridians, which is a concept used in Chinese medicine where it is a network that's formed throughout the body where energy flows. And this energy is called qi. So illness or pain will be present when the flow of qi is blocked in the meridian. And we had to look at the list of meridians in the upper and lower limb. And we had to go at inserting needles into the specific points of these meridians. We've also revisited the pain theory, which is emphasized a lot in the MSK modules for first year and second year. And we've learned about how this theory is applied into acupuncture practice. Finally, we've also learned about some dry needling techniques, which is used for trigger point release. So we've learned two needling techniques, which are the gentle needling technique and the vigorous needling technique. So gentle needling involves fully releasing the trigger point by inserting the needle into the trigger point and gently rotating the needle on that trigger point. It can be timely, but it is less painful. However, for vigorous needling, it will be a quick trigger point release by continuing to rotate the needle in the trigger point regardless of the pain. However, this can only be applied for short-term effects because the trigger point will be back. One eye-opening thing that I've learned in the acupuncture and dry needling course is that acupuncture can be applied on pregnant women or women during postnatal period. Also, a key safety note that I did not know before starting the course is that for acupuncture points that are located near the lung, we have a specific manner for placing the acupuncture needles away from the lung. If we place the acupuncture needles towards the lung for acupuncture points near the lung might be at risk for puncturing by the needles, which could cause pneumothorax. So both sports massage and acupuncture and dry needling are both very effective treatment modalities. But what's the difference? So soft tissue massage involves manipulating soft tissue to improve blood circulation and enhance muscle recovery. However, acupuncture and dry needling involves inserting needles into specific points, especially trigger points, into specific meridians to stimulate pain relief. In addition, sports massage involves longer sessions with more continuous contact with more than one part of the body. However, acupuncture and dry needling involves inserting needles into one specific part of the body, and the needles that are inserted are generally more localized and target one specific issue. So this summarizes my experiences of having the sports massage and the acupuncture and dry needling courses. Thank you very much for watching. If you like the content of the channel, please do like, comment, subscribe to the channel, as well as share this video to your family and friends. Thank you all very much for watching. Take care, and I'll see you in the next video. Peace.